Okay, a lot of people come to me with a diagnosis of either a bulging disc or a herniated disc. What I'm going to do is show you a couple of techniques that you can incorporate into your training that might not help everyone, but it has helped a good 90% of the people I've worked with. Okay, the first technique is called a lateral shift correction. Now, when somebody comes to me and they have a bulging disc or a herniated disc, a lot of times they'll be standing straight, but their upper body is shifted to the side. They're not side bending. Their whole upper body from the waist up is actually shifted. So that's the first thing that you want to correct. So if that person is shifted to the left, okay, and you can see that from the front or from behind, what you're going to do is have them walk to a wall and get their left shoulder against that wall. Okay, once they're there, have them put their right arm horizontally out to the side, and then you're going to have them glide their hips towards the wall. Now, the purpose of having this arm out to the side is because you want to make sure that they're laterally shifting their lower body and they're not just side bending. That's not a correction. That's a correction. Now, this isn't the most comfortable technique, but you do want to correct that lateral shift as soon as you can. Now, the next technique that's very helpful for a bulging disc or a herniated disc is spinal decompression or traction. Now, if you don't have a traction unit available, what you can do is have your client hang on pull-up bars. And what they're going to do is climb up onto the pull-up bar. You're going to have them tighten their lats all the way down their lower back, all their paraspinal muscles into their glutes. And then they're going to hold it for a couple seconds and then relax. And let that lower back just totally distract. You can actually feel it once you relax. And they're going to tighten it again, all the muscles of the spine, including the glutes, and then let your body just hang and feel your vertebrae distract. Then the purpose of that distraction is to put a space between the vertebrae to allow the disc to push back into place again, to let the nucleus of the disc move back into place again, so that the pressure comes off the nerve root, which is affecting your leg or your hip. Now, if you go to a hospital and they give you an MRI and they diagnose it as a herniation or a bulging disc to the left, which usually a bulging disc either goes posterior or posterior lateral. Let's say you're feeling symptoms down the left leg, most likely the disc is bulging back into the left. So a good treatment for that is to put your hands on your hips and extend back. Extend back. Now, if you can tolerate that, try to extend back and diagonally towards that bulge. Okay, again, the goal of the extension is you're trying to push that nucleus of the disc back into place where it belongs to take the pressure off the nerve root. So, standing up, extend back and towards that area. The whole goal is to centralize your symptoms. So if you have a herniated disc or a bulging disc and you're feeling symptoms down, let's say the left leg, your goal is to get those symptoms to travel up the leg and centralize in the back. Even if the pain becomes more intense in the lower back, you want it up the leg and in the lower back, and then eventually focus on getting it away from the lower back also. Now, if you do a technique that causes more symptoms down the leg, or it causes the symptoms to go further down the leg and into the foot, stop what you're doing. Okay? You don't want it to peripheralize, you want your symptoms to centralize. Okay, last technique is going to be extension in prone, or lying flat on your stomach. Okay, so what you're going to do is just lie straight out. Just hang out on your forearms for a little bit. Put a timer on for 30 seconds or a minute. See how long you can tolerate it. If this becomes easy, then you can do a prone prop, which is sinking down flat, pushing up. Again, the concept is sort of milking that nucleus of the disc back into place again. If you can, try to go into what's called a cobra stretch. Full extension, back down. Now again, if you know what side the disc is bulging to, you can do an extension with a bias to the left or to the right, whichever side the disc is bulging to. And again, most importantly,